Good morning, Joe Roble, once again back with the fabulous Dr. Newhalfen. Today, Dr. Newhalfen is going to be discussing proper breathing techniques as it relates to lower back pain and neck pain. Good morning, Dr. Bob.
Morning, Joe. Thanks.
Excellent. Glad to have you. You're having me, actually. We're at his office in Crown Point. So why don't you go ahead and tell people what you'd like to say about proper breathing?
Well, we live in a very stressed society where a lot of times that stress leads to improper breathing techniques, or a lot of times it's chest breathing. And so, the main muscle that is involved, or one of the main muscles that is involved with breathing, is the diaphragm, which sits right underneath our rib cage, and it actually connects the front to the sides to the back. So essentially, think about it almost like the roof of your house. It goes and encompasses all parts of the house. And so the diaphragm muscle has three main functions. Its number one and primary function is to help you breathe right. Its secondary function is good posture. So those of you who are constantly, have bad posture and are constantly thinking about, oh, I got to have good posture, if you don't breathe right, it doesn't matter how much you think about your posture, you're never going to, I shouldn't say never, but you will most likely never adopt good posture because you're not utilizing the muscle that primarily helps you do that. And then its third function is good sphincter control in your esophagus. So those of you with GERD, certain types of GERD have a lot to do with the control of the diaphragm because it helps close it, which leads to no regurgitation of food and acid. So a lot of times there's what's called a functional component to GERD because you're not utilizing that muscle appropriately to keep everything down. So what I would like to talk about today and just show you an example of two of the different types of breathing and then discuss with you how they relate to neck and low back pain.
Excellent. Bear with us as we go ahead and move the computer here so you can show us the proper way.
So I'm going to use myself as an example here, folks, just so you can actually see what I'm talking about. So for those of you who've had kids, what moves when they're sleeping? So they're breathing, they're sleeping, there's no conscious control. What moves? Their belly moves up and down like this when they breathe. And if you watch my bottom hand, you'll see it go up and down. Well, my top hand, this one, doesn't move at all. And that is so it's a pattern that we're born with in our brain to breathe like that. So what happens a lot of time is we adopt the fight or flight mechanism due to stress, due to bad posture, due to sitting. Sitting is very inhibitory to our diaphragm and good proper breathing. So what happens is we adopt this pattern of chest breathing. And if you watch my top hand, this is the one that moves and my bottom hand doesn't move at all. Now that is bad breathing. And so the body can do it, but it's not the way we were meant to breathe. And what happens is when we do this, all of our neck muscles, our shoulder muscles, our neck, they have to help assist that breathing pattern. And so they'll forever be tight. So for those of you who say that you hold your stress in your shoulders and you've got massage and 2 days later you're tight again, check your breathing patterns. This is a really simple way to do it. Just lay on your back, put one hand on your belly, right at your belly button, one hand on your chest, like right on your sternum, and feel which one moves. If you are a chest breather, you will almost certainly have a lot of tension, tightness, headaches in your neck. And possibly some neck pain. And then, as for the belly breathing, the diaphragm muscle that I talked about earlier, which is, it works on good breathing and good posture. That posture, one of its main functions is to help stabilize the low back. Well, if you're not utilizing that muscle, you don't have good stability of your low back, and you could also have low back pain. So proper breathing is absolutely essential to good stability in not only the neck but the low back and really the whole body. And so think about the body as like a hydraulic machine. So a hydraulic machine utilizes pressure to create more stability. Well, we use breathing to create pressure and air. So with every breath you take, you can either make yourself less stable and more likely to have pain by taking a chest breath, or more stable and less likely to have pain by taking a belly breath. And now when I say belly breath, this is a very generalized example. Ideally, what you want is nice, good 360-degree breathing. So think about it like a balloon. When you blow a balloon up, it doesn't just blow up in one direction. It blows up all the way around in a circle. And so just breathing into your belly also isn't exactly correct. I'm using this as a very general example for you to visualize. What you really want is if you can put your hands around your waist and take a big breath in, what should happen is you feel your belly, your sides, and your back all expand like a balloon. That would indicate that you actually have pretty solid breathing. So once again, chest breathing is typically bad, while not just belly, but good 360-degree activation is good and is the way that you want to breathe. And if you watch a professional athlete, for instance, an Olympic level sprinter, you're not going to see them when they run moving their chest up and down a whole lot when they breathe. Typically, this area from here to here is a statue. All their breathing is here, and when they breathe, their ribs are expanding out, not up. So, that's probably a little more detail than you wanted to know about breathing, but breathing is absolutely an essential facet of not only life, but of a pain-free life. So, Joe, do you have any other questions for me about breathing and anything like that?
I've always heard the proper technique is in through the nose, out through the mouth. Is that accurate?
That is, typically if you breathe in through the nose, that is a certain pattern in the brain that will create good belly breathing for you. And then out through the mouth, that slow exhalation causes you to keep a little air and pressure in here, which is essentially what you want. But for those of you with stuffy nose, or congestion, you'll find that breathing in through your nose is essentially impossible. And so, there are a lot of YouTube videos on good breathing, but what I would say is, do that test on yourself. Like I said, laying face up on your back. Testing it seated is completely different. It's a little more complex for the brain, and you might find it essentially impossible to breathe through your belly. That's a really ingrained pattern. But for those of you who find it breathing in through the nose hard, it's not that it's not correct. It's just that some of you might not be able to do it, and so that's where a professional like me comes in. If you find that you're having difficulty learning how to do this, I, like some other practitioners, are versed in techniques or different exercises that stimulate the brain to do that for you. So it creates that proper breathing technique without you actually even having to think about it sometimes. So
cool, interesting. Well, as Dr. Bob said, I think you had a nice little education on breathing here, whether you wanted to or not. And you're right, it's an essential part of life. Tell them what your tagline is, Dr. Bob. What's your motto?
Well, my motto is movement for life. And, we all have heard the term, we all want good quality of life. We don't say quantity of life, we say quality of life. And movement is an essential component to life. And so the better quality of movement you have, essentially the better quality of life you're going to have. And for those of you who are a little older and have had a knee replacement or a hip replacement, or, we've all seen people that have a hard time moving, we know that their quality of life struggles because they don't move well. And so movement for life is something that really hits home to me, because I know that good quality of movement is really, really important to living a long and healthy and happy life.
Fantastic. Well, if you have any questions or would like to talk to the top-rated chiropractor in Northwest Indiana, give him a call. He's at 219-322-6942, or check out his website at NWIchiropractic.com. Thanks, Dr. Bob, for the education as always.
Thanks, Joe. Thanks, folks.
See you next time.